Okay, first we will begin by scanning the room. Okay, and now I will begin my head-to-toe assessment.
Come in.
Hi, I'm Maddie. I'm your student nurse today. I'm just going to shut the door for your privacy and wash my hands. Do you have any allergies?
No.
Any pain?
No.
Okay. Can I see your wristband?
Of course.
Can you tell me your first and last name and birth date?
J. Johnson, 11/16/95.
Okay. Patient appears stated age. There's no foul odors. Patient appears to have good upkeep of her personal hygiene. Patient's mood is pleasant, calm, cooperative. Do you know where you are?
University of Detroit Mercy.
And do you know what year it is?
2016.
Okay. Patient is alert and oriented ×3. So now I will begin my assessment. Is it okay if I touch your head?
Yep.
Okay. Okay, hair distribution is equal. No masses or lesions. Skin is intact. There are no moles, but if she did have moles, I would use the ABCDE assessment tool to assess them. Okay, so first we're going to do your eyes, and if you could just open them really big for me. Okay, pupils are round and equal bilaterally at 3 millimeters. Is it okay if I touch your face?
Yeah.
Okay. Conjunctiva is pink, and if you could just follow my light. Okay, cranial nerves 5 and 7 are intact. 3 and 6. Okay. And just look at me. Okay. Pupils are reactive to light and accommodation. And now we're going to be looking at the patient's mouth. If you could open your mouth for me and stick your tongue out. Okay. Uvula is mobile and midline. Tonsils are at a +1. Mucosa is pink, moist, no lesions or masses. Teeth are white. Straight. All of them are present. She has no missing teeth. She has no dentures. No dental work, no cavities or anything. Okay, so now we're going to be assessing the patient's carotid arteries. So first, I'm going to feel the arteries one at a time. Okay, carotid artery is equal bilaterally at a +2. Carotid artery, carotid pulse. If you could hold your breath for me. Okay, so, sounds good. Okay. So now I'm going to be listening to the patient's heart, and first I'm going to listen at the aorta, or aortic, pulmonic, herbs, tricuspid, and mitral. So aorta is located at the second intercostal space. Pulmonic is located at the second intercostal space. Herbs is located at the third intercostal space. Tricuspid is located at the fourth intercostal space. And mitral is located at the fifth intercostal space, left midclavicular line. And I would listen at that location for 60 seconds. Also, down here at the apex of the heart, we hear S1 the loudest, and up here at the base of the heart, we hear S2. So now I'm going to be listening to lung sounds in 10 places, posterior and posterior, on the patient. And if you could just take a deep breath in as I move down your chest. so I'm going to be listening at the sides. Okay, lung sounds are clear. No adventitious sounds, at least on the front. So now I'm going to be listening to lung sounds on her back. Take a deep breath in, please. Okay, lung sounds are clear on the back, no adventitious sounds. Okay, so now I'm going to be moving on to her abdomen. So if you could just lay down for me. Okay, is it okay if I lift your shirt up?
Mm-hmm.
Okay. So the first thing I'm going to be doing is inspecting the abdomen. Abdomen skin is appropriate for ethnicity. There's no masses, lesions, bumps. Skin integrity is intact. There's no moles, but if she did have moles, I would do the ABCDE assessment tool to assess those moles. So now I'm going to be naming the major organs in each quadrant. In the right upper quadrant, you have your stomach and your kidney and your spleen. In your left upper quadrant, you have your left kidney and liver. No, okay, I mixed those up. Left quadrant, you have your left kidney, your stomach, and your spleen. Right upper quadrant, you have your right kidney and your liver. Right lower quadrant, you have your right ureter and your right ovary. Left lower quadrant, you have your left kidney and your left ovary. So now I'm going to be listening at each of those 4 quadrants. Okay, so there's some gurgling present. The bowel sounds aren't hypo or hyperactive. They sound pretty normal. So now I'm just going to be percussing. Okay, so in all quadrants but the left upper quadrant, I was able to hear the percussions except for the left upper quadrant where the liver is located, where there's just dullness. And, okay, if you could sit up for me. Okay, at 45-degree angle, patient has no jugular vein distension. So now I'm going to be assessing your arms. If you could stick those out for me. So the arms, skin color is appropriate for ethnicity. There's no masses, lesions, skin is intact. There's no impaired skin integrity. I don't see any moles. If she did have any moles, I would use the ABCDE assessment tool to assess them. So first I'm going to be feeling her pulses. So, okay, so her brachial pulse is equal bilaterally at a +2. And her radial pulses are equal bilaterally at a +2. If you could stick your arms out again. Okay, so skin temperature is moist, it's dry, or skin temperature is warm, it's dry, yeah. There's no cracks or anything. Okay, so if you could, to check for clubbing, I'm going to have you put your hands in the shape of a heart. Okay, so as you can see, there's no clubbing of the nails. And then if you could just grasp my fingers. Okay, so patient is has strength in her arm. She was able to grasp my fingers, and yeah, that was equal bilaterally. So now I'm going to be assessing her lower extremities. If you could just, here, do you want to actually just sit back and then, yeah, if you could pull your the legs of your pants up. Okay, so patient's skin color is appropriate for ethnicity. There's no masses, no lesions. Skin is intact. Yeah. Okay, so now I'm going to be assessing her pulses. Okay. Popliteal pulses are equal bilaterally at a +2. Dorsalis pedis pulses are equal bilaterally at a +2. And tibialis pulses are equal bilaterally at a +2. Okay, so there is no edema on the patient's lower extremities. Yeah, there's no swelling, no fluid retention. Okay, so if you could stand up for me. And I'm just going to percuss her back. Okay, so let me know if you feel any tenderness.
Nope. Nope.
Okay. And then if you could just lean over so I can assess your spine. All right, spine is straight, no curvature. Okay. So we should probably do the Rotberg test. Okay. So if you can, I'm going to be standing behind you just in case you fall, but if you could just close your eyes for 20 seconds so I can observe. Okay, so there's no swaying. Patient is stable. Okay. And so now we're going to, sorry, you can open your eyes. Now we're going to be performing the get up and go test. So basically you're just going to be sitting down. Yeah, this is good. You're going to be sitting down. If you could just like stand up and sit back down, stand up, like walk a little bit. Okay. Okay. I believe that concludes my head to toe assessment.